Welcome back to GTU. February is American Heart Month, a time when all of us can focus on our heart health.
And joining us now in this sponsored segment is Dr. Kent Meredith from Intermountain Health. Welcome.
Thank you. It's nice to be here.
It's always good to talk about your health and your heart, especially in February. But there are some things that we can do to improve our heart health.
Right, and this is a great month, and we love coming down here and reminding people what they can do, because it's actually, you can be proactive about this, and you don't need to wait until you become sick to worry about your heart. You can start working on this when you're young and healthy. So,
all right, let's jump into the first one. You say stop smoking. If you haven't before, don't start.
Right, yeah, so I mean, this isn't going to surprise anyone, right? But I think what might surprise some people is that e-cigarettes and vaping is also now shown to be unhealthy for your heart. So it's not a good habit to start, and even though it's difficult, there are things that we can do to support people if they're ready to quit.
There are steps you can do slowly, and stop smoking is one of them, vaping as well. Number 4, know your numbers, blood pressure. Incredibly important to know, because that's an indicator of, hey, I might need to do something.
Yeah, so this is an easy one. Know your numbers. It's just you know your blood pressure, your glucose or your blood sugar, and your cholesterol. So this is one that you would probably want to go in and schedule an annual visit with your primary care doctor, just so you can get a checkup and find out where you're at.
What age are we talking to? Who should know their numbers?
Well, certainly I think if you're getting close to your 30s, this is a good time to start being aware of that. If you have a family history, maybe even a younger age.
I thought you were going to say 50 plus, so everybody out there that's younger, you need to think about it.
I think we're all responsible for knowing where we're at, yeah.
Agreed. And when you go into the doctor's office, you immediately take your blood pressure, so take note. Am I in the right area?
Yeah.
The right number? So that's a good step. All right, know your risk. Get a coronary CT scan. This is what I've been hearing more and more often, and more people are getting them.
Yeah, I'm glad you're hearing about this, because I think it's an important test that is valuable. Everyone kind of wants to know, well, what if I have heart disease but I just don't have any symptoms? And that's where this test can be useful. So go to your doctor if you're over 40 and ask if a coronary calcium score is something that would be beneficial. And it's a test, it's a very quick, simple, and relatively inexpensive test to look for evidence of early heart disease that hasn't yet started to cause symptoms.
Oh, you can do that just right in your doctor's office?
Not in the doctor's office, but they can order the test, and then you can go and have it scheduled and done.
So if you're concerned, that
pretty
might be
easy to do, yeah.
A great idea. Yeah. Maintain a healthy weight.
Well, okay, so this is one where it sounds difficult, and it is. It's kind of like smoking. I mean, it's hard to keep your weight healthy, but most of us, if we look at our BMI, we're probably above 25, and if you are, this is just something that you could do something realistic, like set a goal for 5 pounds, and just say, I can lose 5 pounds. And then you'll see that you can do it, and you'll kind of learn how you did it. And then you'll kind of be more positive about it. It doesn't hurt anyone, and even if you're at a healthy weight, you know, be aware of what you're eating and what it's going to do to your body.
So these top 5, and number 1, exercise, is really all about lifestyle.
Yeah.
That's what heart doctors especially, talk a lot about.
Exactly.
And know what lifestyle, and maybe take in a Mediterranean diet, all of those things come together.
Sure, and I put number 1 as exercise. Really all I'd like people to do is just go for a walk for 30 minutes, because that's the most, that's going to have the most impact on your long-term health. And if you say someone is in their 50s or 60s now, if they could look into the future and say, when I'm 60 or 70 or 80, I want to have an active lifestyle. I want to be able to visit grandkids. I want to be able to go on vacations. Well, the best thing you can do now is to just be active. You know, go for a walk, ride your bike, go swimming, things like that. And that's a big impact on your future health.
If you don't move, you stop being able to move.
That's right.
Right? You've got to keep going. There is a quiz, everybody, at intermountain.org/heart that you can take that can assess your heart health. So it might be worth your time to just go take a peek. It is February. It is Heart Month. And you can also go, there are videos that show you different activities and ideas for your heart on the website.
Yes, go for that walk, says Dr. Meredith.
Right.
Thank you so much for that message today, and thank you to Intermountain Health for this sponsored interview.
All right, still ahead.